In this video, we'll talk about the lab tests related to kidney function. Why do we even care about kidney function in diabetes? First of all, some diabetes medication could potentially reduce kidney function. For example, SGLT2 inhibitors. Also, the dose of some diabetic medication like metformin needs to be reduced or just cannot be used if kidney function is very low. Diabetes itself can also harm kidney, especially if it is not well controlled. One of the most commonly used markers for kidney function is creatinine. The higher the creatinine is, the lower the kidney function is. For most people, creatinine should be less than 1.2. Young men or very muscular people may have a little higher creatinine, but should not be higher than 1.4, while older people should have a lower creatinine level, typically less than 1. The other marker for kidney function is called eGFR. It's actually a number calculated by considering creatinine, age, gender, and race. Generally speaking, an eGFR greater than 60 is considered normal, although younger people should have eGFR of around 100. eGFR is closely related to creatinine. The higher the creatinine is, the lower the eGFR will go. So the lower the eGFR is, the lower the kidney function is. In other words, eGFR and kidney function go in the same direction. If your eGFR is less than 20, you're getting close to dialysis. Now I will show you how to use these markers in real life. This is a 67-year-old gentleman who was on metformin 1,000 mg twice a day for type 2 diabetes. His A1C was 7.6, so it's a little high. We decided to add Jardiance. Jardiance is a medication under the class of SGLT2 inhibitor. His creatinine was 1.0 and eGFR was greater than 60, so he had normal kidney function before starting the medication. 3 weeks after he started to take Jardiance, however, creatinine went up to 1.7 and eGFR went down to 41, so his kidney function is much lower than 3 weeks before. As we know, occasionally SGLT2 inhibitor like Jardiance can reduce kidney function, and this is probably what happened here. Since there was a significant decline of kidney function in a short period of time, we need to act quickly to prevent kidney function from going further down. So we suspended Jardiance. In addition, when eGFR dropped below 45, the dose of metformin should not be more than 1,000 mg a day. And if eGFR is less than 30, metformin should be stopped. In his case, eGFR of 41 falls between 30 to 45. So we reduced the dose of metformin to 500 mg twice a day, which is a total of 1,000 mg for a day. The second example is a lady with type 2 diabetes for more than 5 years. Her A1C has always been above 9. A year ago, her creatinine was 1.1 and eGFR was 57. Now creatinine is 1.4 and eGFR is 49. So there was a moderate decline of her kidney function over the past year. The change in kidney function has been slow, so instead of doing something urgently, we should first find out why her kidney function has been going down. It's most likely due to diabetes, as her A1C has always been much higher than 7. In order to prevent kidney function from sliding further down, her diabetes needs to be better controlled.